This is a proposal for a support group for military veterans. First, we will be talking about the background of the group and population, then the needs of the population, the purpose of the group, barriers to seeking help, group logistics, group type. Then we will talk about group goals, therapeutic approaches, and treatment plans. We will discuss confidentiality and attendance, group norms and group leaders, and finally, we will review group stages. This group is open to service members in all branches of the military ages 30 to 45. This group will provide psychoeducation and psychotherapy for members. Integrated cognitive behavioral therapy, or ICBT, and interpersonal psychotherapy, or IPT, will be utilized.
Our support group for military veterans supports members who have needs of substance abuse treatment, individual counseling, as well as group counseling, emotional support, development of self-care and coping strategies to use in session as well as outside of session, disability resources for veterans who have disabilities, and in-person sessions, which are prioritized over virtual sessions.
The purpose of the group is to build healthy and trusting relationships with other individuals, gain skills to cope with PTSD. Mindfulness techniques, meditation, yoga, and breathing exercises are all examples of those skills. Provide psychoeducation and provide psychotherapy using ICBT and IPT.
There are a few barriers that may disrupt veterans from seeking help. One is that they may be resistant to receiving help. This may be for multiple reasons, such as the second reason, that they may fear experiencing emotion or appearing weak to others, including other group members and possibly other co-leaders. Also, there may be a lack of resources for veterans in that specific veterans community.
Group logistics. This will be a closed group with a maximum of 8 members. There will be an outpatient facility at Virginia Community Based Outpatient Clinic, and there will be 2 unique sessions. So possibly 6 weeks where the meetings will last for 90 minutes from 6 p.m. to 7:30 p.m. on Tuesdays and Thursdays, so twice a week. And then there will be a reevaluation at 4 weeks. Or they could choose 12 weeks and the meetings will be 90 minutes from 5:30 to 7 on Wednesdays, so just one time per week with a reevaluation at 8 weeks. The groups will be open to all veterans of any branch of the armed forces. Recruiting through interviews, referrals, and web page posts will take place, and individual screenings will be done by co-facilitators prior to being admitted to the group.
Our group type will focus on 3 categories. One being group counseling, where in group counseling there is an abundant amount of support from others and you can give and receive that. You gain a sense of belonging because a lot of times we don't feel like we belong in that group, especially if it's new to us. And then you'll also be in a safe environment because that's what group leaders want and that's what group members expect to have. We will focus on ICBT, and through that, the patient will be able to receive education about the PTSD. You'll receive some mindful relaxation activities, and then you'll be able to do some flexible thinking around the PTSD with the veterans. And lastly, IPT. And with this type of style, there will just become an alliance with the therapist for interpersonal change within the group member. Therefore, the group member and the group leader will work together to change the internal parts that they want to change. As group leaders, we have some goals for our group members that we hope that they can achieve at the end of each and every session. The first is to recognize their own triggers. By recognizing their own triggers, it would allow them to figure out what they can and cannot do to avoid that situation. Triggers can range from loud noises to overpopulated spaces to even seeing anybody in an armed force uniform. Next is to re-experiencing intrusion. Intrusion ranging from nightmares, flashbacks, and involuntary memories. Lastly, we want them to be able to function in the real world. With that, we want them to be able to get to their way of life and how it was before their PTSD diagnosis, because PTSD can typically stop someone from moving forward on in life. Although these are the goals that we have for our group members, we want our group members to come up with their own goals within the session. By doing this, the group members will be able to connect with their personal experience and what they hope to learn in this counseling session to grow from it.
We will be using two different therapeutic approaches. ICBT has basically, we talk about their high comorbidity with people suffering from PTSD and substance use disorders. So PTSD and substance use symptoms have proven to be reduced over time with the implementation of ICBT. Reworking of this method will be needed for retention of the population. So what that basically means is we'll have to allow our group to sort of guide us through this process, and the needs of the members of the group will guide us through using this approach. And then therapists facilitate members in seeking safety and possibly using prolonged exposure. And then there's psychoeducation and exposure treatment as part of this as well. IPT is recommended for groups that are working on PTSD skills. So initially, the Hamilton Depression Rating Scale should be used, and that can be done as part of the screening process of the group. And then the focus should be on affect, life circumstances, and relationships, and the results of trauma on those parts of your life, not just on trauma itself. And then this is proven to reduce symptoms when it's implemented correctly. And therapists facilitate members to explore their roles in interpersonal interactions and learn what their inclinations are in relationships, and allows them to provide a sense of community and support when this is done in the group therapy environment.
So when looking at treatment plans for group, we want to look at the treatment plans as a whole for PTSD, and some of these can assist of is EMDR, pharmacotherapy, and psychotherapy, mindfulness, CBT, especially cognitive processing therapy, and prolonged exposure, also called PE and CPT, some SSRIs, and logotherapy. The biggest factors that we want to look at outside of, medicine and treatment is the CBT and the mindfulness. But also, like, when we're having a group, we want to be mindful that some might be on medication and some might need medication. So it is good to know in a general space of what exactly medications are best for PTSD. So, as said before, when CBT is one of the strongest treatments outside of drugs, especially looking at CPT and PE, and CPT, also cognitive processing therapy, focuses on the trauma, which helps the client identify negative thoughts related to the event, understand how it is causing stress, can help replace those thoughts and cope with unsettling feelings. PE, also prolonged exposure, explores the trauma in a safe space, especially in clinical settings, helping the patient change how or she reacts to memories of traumatic experiences, as well as learn how to master fear and stress, including situations moving forward. So these are good, just because they have shown that they have worked before. They have showed that it can decrease anxiety, depression, even work with PTSD. This would be good, especially with group, because we're not working with medicine. We can figure out what group members, what thoughts and events is coming with the military experiences, kind of what purpose they have, kind of figure out what goals, expectations, and kind of we can change those thoughts and those feelings that they have, especially negative ones, and really help them process to change them. For the last one we're going to look at is mindfulness. And these can be very effective because obviously we know how mindfulness works, but also it has been found that it can improve relaxation and helps for rumination and anxiety. Also, what we consider with mindfulness is breathing exercises and yoga, which is definitely something that could be brought up within group. At some points, as an activity, yoga could be used, and then breathing exercises that can just kind of be in your chair, kind of just take the time to see how you are in the present moment, see how you're feeling. But mindfulness-based stress reduction helps reduce depression, anxiety, and even helps with quality of life. Mindfulness based cognitive therapy. This is having two components where you are using the cognitive behavior therapy, but also using the mindfulness, which can be very effective because we know that we want to use CBT as a treatment. So if we can use both of them at the same time, it can see some effectiveness. Some compassion meditation can be used also, and that is when you recognize that your own suffering and joy is a part of suffering and joy. Also within group, mindfulness can be very effective because it helps you have that positive support with each group member, and you can kind of get that support network. You kind of doing this all together, like you're going through the same things with each other. Also, another point that would be very effective is the group leader and the group to look at how they can keep doing these mindfulness practices. We don't want to just introduce them to them and then just let them forget about it later on in life. We want to figure out a effective plan for that to work.
An important aspect of the group process is understanding confidentiality. One expectation is to create a space where everyone feels comfortable sharing. We don't want members to worry about their thoughts, experiences, opinions, and etc. being shared with individuals outside of the group. We also need to highlight the 4 limits of confidentiality. Those being that if a member is a danger to themselves and or others, if there are any reports of sexual abuse or neglect with a minor or a vulnerable adult, or if the group leader is subpoenaed by the court, confidentiality would have to be broken. Additionally, members do have the option of requesting their information to be released. To help maintain confidentiality, we aim to implement accountability partners in this space. If members ever have a topic of concern or any other lingering thoughts, they can share their ideas with their group members prior to attending the next session. When creating group norms, there are 3 primary factors to consider: establishing respect, acknowledging each person's boundaries, and knowing your no's. A part of establishing respect is creating a space for each group member to have the opportunity to share without interruption. Something to note is, although we encourage participation, we do want to limit storytelling. The next point, being aware of personal boundaries, is so group members know how to interact with each other. This could include not using vulgar language, learning each other's pronouns, and other behaviors to ensure that we are maintaining a respectful environment each session. Due to the nature of PTSD, it is important for members to be aware of their triggers and communicate topics that may be too overwhelming for group so that we can avoid them. Lastly, members will have the opportunity to create their own group norms that can be revised as group continues. Going over attendance and lateness is an important extension of our group norms and expectations. Consistent absences and latenesses greatly interrupt the group process. It can take away from the formation of trust between members, and other individuals may lose motivation to continue attending if sessions are missing people. Communication is key in the instance that a member is running late or will be absent. It is expected for members to reach out to their accountability partner and/or group leader. The session will start on time, but those who came late can join the conversation as soon as they settle.
Group leaders in charge of this specific group counseling session, we would need 2 co-facilitators. With these 2 co-facilitators, they must have a background of psychology, counseling, or social work and obtain a bachelor's degree in that field. We would also hope that they would have a certificate in a field related to any type of trauma, because PTSD is a trauma-based disorder, and we want to make sure that they are receiving ample amount of information about it. For personal characteristics, we want the group leaders to have critical thinking skills, empathy skills to be able to empathize with one another, be able to have some problem-solving skills as well to help the group members go through the different scenarios that may come about. We hope that they are also trained in CBT and mindfulness-based interventions, because this is what our theoretical orientation within this whole group counseling session is about. And also, we just want the group leaders to have some sort of knowledge about PTSD and what triggers there are out in the world, because triggers can vary from person to person. But if the group leaders are not knowledgeable about that, the empathy skills may go downhill as they cannot relate. As group leaders in this group's counseling session, we have key roles that you must present. One, you need to have structure for this group. The structure of the group will help not only you, but it will also help the group members along with its organization and the timing of it. Because without the structure, it's hard to be organized and it's hard to get the words from your group members. Next, you need to be able to teach cognitive and behavioral techniques along with the mindfulness techniques, because within this group, we talk a lot about cognitive behavior and what things you can do with the mind to get through the different situations you may come through. Next, you have to be able to have empathy skills. If the empathy skills are not there, it will be hard for this group to actually continue, because without having empathy, you're just listening to what they're saying. And a lot of times they want you to empathize with them to let them know that you hear them and you hear where they're coming from. And lastly, you have to be able to have stamina for this, both mental and physical. If you do not have the stamina for this group session, it can be tiring. So for mental, you need to be able to make sure that you are fit for this group counseling session. And physical, you need to make sure that you can physically be present for what is about to get told to you within that session.
Now we will review group stages, starting with the initial stage.
Okay, so looking at PTS, military veterans, we are looking at the initial stage, and with that, we're gonna want to start that forming stages. So at this point, we will see that members are going to explain why they're into counseling, what they expect from counseling, their goals for counseling. Even a group member might do an icebreaker or activity to kind of get everybody thinking, kind of get everybody relaxed, make them trust, and then kind of get a little safe, more comfortability. Obviously, you have to go over the norms and confidentiality, so we want to make sure that everybody feels safe and feels comfortable. Also, we need to figure out what can be shared and what can't be shared, because with this, we don't want somebody war storing or triggering somebody else. So we want to make sure that we keep it in a safe space and make sure that everybody has the space to talk, but it isn't triggering and we don't create too much conflict or make somebody want to leave. At this point, too, we won't really see group members really talk too much, so we want to make sure that as a group leader, we want to make sure that you give each member the space to talk. Also, we might see that it's a lot of resistance. At this point, group members might not be willing to share. So at this point, now we probably will see that the group leader will take more of a active role and kind of lead to explain how this works, what's happening. Some expectations that can happen is that the group may be too dependent on the counselor. At points, it could be a triggering moment. We don't know. It is a screen. We do have a screening process, but we're not sure like where everybody is at. It might be some catharsis within because some might be ready for counseling, some might not be ready for counseling. So we never know how the group members will actually feel until they're in. They might be hesitant to share their experience. That could be a lot of different things. They might not want to sound dumb or that they're not understood. Things like that. And then just kind of making sure that they're telling their story, but they're not fully understanding their experience and kind of what their purpose is. So definitely working through this, but it'd be kind of a roller coaster at points. It might be up, some might be down. So
Now moving on to the transition stage.
The second stage of the Allen stages of group therapy is the transition stage. During this stage, storming takes place. Members typically experience feelings of defensiveness, resistance, anxiety, and fear of judgment. Also, group leaders begin to introduce mindfulness-based material to the group. Within the transition stage, there are a few group expectations. The first expectation is that group members may be resistant to express any issues they may be experiencing. This is very common in the veteran community, as emotions may be a sign of weakness. Also, members may have conflict with one another, which is common to see during the transition stage because a lot of members are experiencing their own internal conflict. Members may also judge one another or judge other members who choose to speak out. This is because a lot of members are not comfortable with sharing emotions. And finally, members may be resistant to interacting with mindfulness-based materials as a form of resistance to the group process. There are a few techniques that counselors can use or co-leaders can use to defy this resistance. The first technique is the here and now. An example of this is by using immediacy to head-on attack an issue with a group member. Another technique is to use I statements, which is used when a member may try to deflect an issue they have by bringing up another member, but instead a leader or co-leader may have that member use an I statement to express the member's own feeling.
And now the working stage.
okay, this is the working stage, and what we like to call it, this is where the fun happens. This is when we start really getting to work, really start seeing some progress being made. At this point, we will see that cohesion is being built. So this means that members are linking to each other, relating to each other. The group leader doesn't have to do too much. The members are doing it on their own. They're kind of feeding off of each other's points. Kind of, I agree, I disagree. We might see some challenges, some built upon type of things. Also, at this point, the group leaders can pull members in. So if a group leader sees that not enough members are talking, they can bring them into the conversation.